You know, having been doing laser vision correction now for 30 years, do you know in the first iteration, when we first starting laser vision correction, if anybody had dry eye, it was an absolute contraindication. You cannot do LASIK on a patient with dry eye. Collagen vascular, a lot of funny things, diabetes, you know. Well, as experience grew, we realized most women after the age of 40, over time they develop dry eye, it's just sort of a downhill course. And if you have LASIK here, right, and maybe your eyes get a little drier for a little bit, when you come out, you're here. So your eyes, of course, are going to be drier, but they were going to be drier anyway. The wonderful thing that's happened is it's really not caused by laser. It's just a progression in life. It can be slightly accelerated for a little while, but you recover. Now we have all these amazing medications, Xiadra, Restasis, we have MibaFlow. We can really make people comfortable. Now the other issue is sometimes patients wouldn't see quite as well as they expected. And we didn't really know they had dry eye. So there's this glare and halo, a little bit of foreign body sensation, because it wasn't really apparent that they had early dry eye. Now we have tear osmolarity. We can measure the saltiness of your tears. We do special tests to determine how much tears you have. How's the tear film looking? All those tests tell us, you know, you're at risk for dry eye. And after laser vision correction, for a few weeks, your eyes may be gritty. We'll give you these special drops. We'll use this other stuff, a little steroids. We'll get you through that, and you'll be back to where you were before. But not only that, we can now treat the dry eye we knew you had before that you weren't really aware of better now. Now, the other thing is there's a pre-selection. People often come in and they say, well, I can't tolerate my contact lenses. My eyes get tired at the end of the day. They don't walk in saying, I've got dry eye. They really have a dryness, or their tear film isn't what it used to be, and they can't really wear contacts anymore. There's a pre-selection. So of course we're going to see more patients who have dry eye. So they need treatment. If you took out their contacts, they need treatment anyway. If you do LASIK, they'll need treatment anyway. There's no difference. In fact, after LASIK, they do better because they don't have to fool with those contacts. They don't have to be irritated by them. They don't have to use those nasty solutions. Once we get them squared away, we get them on a regimen that helps them for the rest of their days avoid dry eye and the symptoms.